Hello, fellow Midwesterners. I'm Dan Mirci and graduated from Midwestern in 2013. I was in Suite H with Dr. Doherty. I worked with Pat from PAL Dental Lab while in school and quickly came to appreciate his quality of work. And I still use him for cosmetic cases because he does such a beautiful job and is easy to communicate with. I have found that communication with the lab you choose to work with is essential in providing quality work for your patients. One of the best ways to communicate with the lab is to use shade mapping to show the lab where you want each shade transition or characteristic. It is imperative to have a good quality camera programmed to take clear macro shots with a quality ring flash. I have found it much easier to communicate with the lab about shade by taking photos with a shade tab next to the tooth, because a shade on the photo can look like many different shades depending on level of lighting. If you take a photo with the shade tab next to the tooth, then the lab can see how the tooth looks compared to the shade tab in the given light. If you have a patient come to you with veneers or crowns across the anteriors, with one of them broken, save as much of it as you can to send to the lab to match it. This is probably the best way to match crowns as closely as possible. Another great way to match existing crowns is to send the patient to your lab for a custom shade. I had a lab I was using regularly that would not communicate anything that I needed to know about to the crown. I began writing on the lab slip to let me know if there was any circumstances that I needed to know about. And it was frustrating that they refused to communicate with me, so I quit using them and have been working on finding another lab that knows how to communicate. It's not worth your time to mess with crowns that could have a simple explanation, such as a crown being at minimal thickness, or if you need to adjust the opposing or anything else like that. I'm in the process of replacing crowns on 5 and 6 on a patient who had crowns done from numbers 5 to 12 many years ago. And I only took a quadrant triple tray impression and expected Pat to make beautiful crowns, which he did. When I was delivering the crowns, the patient did not like them at all because they are perfectly anatomical, but 11 and 12 were made like chiclets. The patient wanted them fixed so they looked like the non-anatomical crowns on the other side. Through this mistake, I learned that first of all, patient-doctor communication is very important. I should have given the patient a mirror and discussed her expectations and included her in the design process. Second, I should have sent a photo or full arch model of the maxillary to the lab so that they would know what the contralateral side looked like, so they could match that a little easier. And I did that the second time when I submitted to the lab. And some patients don't care to be part of the decision process, but it's always a good idea to find out what their expectations are. Now spend some time learning how to shade map with the dentist in your suite or with Dr. Doherty. I know he's a perfectionist and he spends the time to communicate to the lab effectively. Shade mapping is a very valuable tool and will take your ability to communicate with the lab to the next level. Good luck to all of you in the next few years, and don't forget to spend time to be a perfectionist.